Hi guys, welcome back to the channel. If you're here for the first time, I'm Jocelyn Binwi and I'm a content creator based in Douala, Cameroon. In today's video guys, I'm going to be sharing with you all my first healthcare experience when I just came to Douala and my most recent healthcare experience lately. And also I'm going to be sharing with you all my general view about healthcare in Cameroon, and I'm going to be talking about two cities, that is Bamenda, where I lived for long, and also Douala, where I have lived for long. Yeah, so though I've also lived in Boya, that's in the southwest region of Cameroon, but I'm not going to talk about that a lot because while I was there I never found myself at the hospital several times. Yeah, so I don't really have anything to share about that. Yes, so guys, if you're interested in a video like this, just stay tuned and watch till the end. My first hospital experience was at a government hospital here in Bonaberi, Douala. Yeah, so when I just came to Douala, I had lived in Douala, was it for about 1 year or so. Yeah, and I fell sick. Like I had malaria, I had body pains, and usually when I feel such body pains, I'll go ahead and maybe go to the pharmacy and get some malaria drugs and some malaria medications and all of that, and I'll take them and then I'll feel better. Yeah, but at that particular time I took the medications and there was really no improvement, so I had to go and consult at a hospital. So I went to a government hospital here in Bonaberi, and my experience there, you guys, was not the best. Imagine my first time of going to the hospital in Douala, and at that time you can imagine I just started work and I was still struggling. I could not just leave and say I'm going. Private hospitals are more expensive than government hospitals. Yeah, when it comes to healthcare in Cameroon, right, government hospitals are considered more affordable than private hospitals. Yeah, so I went to a government hospital here, and I was really sick. Like I was really down, and when I came to the hospital I had to first of all pay for consultation, and consultation at that government hospital was 600 francs. Yeah, so the least money I had with me was 1,000 francs. The lady was like, I don't have, the lady at the counter, that's the accountant at the hospital, I don't have any balance to give you, I don't have any coins, I don't have anything, so you have to go and look for 600 francs exactly and come and give me, because I don't have any balance to give you. I was like, okay, let me give you this 1,000 francs and then you keep it. When I'm done I can come back and collect my balance, or if you don't still have it by then, I'm going to look for the balance at that time, and then I'm going to look for change outside of the hospital at that time. Maybe I can just go to a store opposite and then buy something so that I can have change, and then I'll come and give you the 600 francs and then you give me back my 1,000 francs. She was like, no, she's not going to do that. She was so arrogant. She was like, no, she's not going to do that, she's not going to do that, that I should go and look for the balance if I really want to consult the doctor. Imagine a patient comes to the hospital that is very sick, that is very down, like my body was shaking, I was shivering, I was feeling cold, I had malaria, and I was sent out of the hospital to go and look for that balance, else I will not be consulted. You can imagine all of that, you guys. The experience was not the best. I had to go out. Now I went opposite the hospital, there was a store there. I had to buy bananas, though I never had to eat bananas. I had to buy bananas for 300 francs so that they could give me back 700 francs so I can come and pay 600 francs for consultation, you guys. So I had to do that. I went out, bought the bananas, came back and gave the lady the 600 francs before she could give me a ticket to go and meet the nurses so that they can send me to the doctor for consultation. When I went to the nurses, the case was not different. Just the queue that was at the nurses, you guys, they were taking their time, and then it looks like they were attending to people that they already know, or they were attending to people that they are familiar with. And especially when you come there and then you speak in English, oh my god, that is just a minus for you. That is just a minus for you. Like I struggled at that hospital that day and I was really down. I started shedding tears. I was really in pain. I was like, oh my god, what is this? So I sat there, I was patient a little bit, and then they finally attended to me. Though the waiting time was really long, they finally attended to me. They sent me to the doctor, and I went to the doctor and consulted. And yeah, when you consult with the doctors, it looks like the doctors at these government hospitals, I don't know whether they are only in government hospitals or also in private hospitals, the doctors have their they have their laboratories, their private laboratories, where they have a particular percentage that they usually send patients there to go and do their lab test, yeah, before they bring the results back to the hospital. And those laboratories are usually out of the hospital, and behold, at these private labs out of the hospital, the amount that you pay for each test is more expensive than what you do at the hospital. So when you go there, it looks like, for people who already know, when you go to the hospital, you need to tell the doctor, when the doctor consults you and he sends you to the lab, you tell the doctor that please, he shouldn't send you to a private laboratory because you're not going to afford for that. He should send you to the hospital laboratory, something like that. There is a game that they play like that because they have a particular percentage at the private labs. Yeah, so the doctor sent me to the private lab, and behold, I went there, and the amounts for lab tests, you guys, was something different. And he prescribed me some number of tests, though he also prescribed some that I should do in the hospital. He prescribed like 2 of them that I should do in the hospital, and then the others that I should go and do out of the hospital at their private labs. Yeah, so after consultation and the doctor prescribing some medications that I was taking while I went to do the laboratory test, yeah, I did the ones at the hospital. And just to go again for the lab test is another queue. The queue is usually so long, and I had to stay in the hospital for almost the whole day. And then the other tests, I had to go by the following day to the lab to do them. Yeah, and it was really much more expensive there. So I don't understand why you go to a government hospital in Cameroon and then they are going to send you to go and do lab tests at a private lab out of the hospital, which is more expensive. Because I believe that so many people who come to the government hospitals are people who maybe they are not able to afford for expensive healthcare at a private hospital or private clinic. Those are the kind of people who come to government hospitals. So I don't understand why you come and consult at the government hospital and then they will instead send you but to a private lab out of the hospital to do your laboratory test. Yeah, so that is one experience that I did not really like. That's one experience that I did not really appreciate. So I'm just making this video in order to enlighten people, especially people here in Douala. This experience is what I had in Douala. I'm going to talk about my experience in Bamenda, which is quite different from this one. Yeah, so I just want to advise people that when you're going to the hospital here in Cameroon, make sure that you have an idea about so many things, how to go about in the hospital, what you can ask from the doctor and what you can reject from the doctor, so that he can give you other options. Because yeah, there are always options. If you're not able to, for example, if you're not able to pay for the laboratory out of the hospital, tell him that you're not capable. Let him send you to another government hospital that is able to do the test and do it there, or you do it in the laboratory that is found in the hospital, so that it's going to be much more affordable for you to pay. Yeah, so that's one experience that I had. Normally in Cameroon, when you go to any public place, any public office, even at the hospital, they are supposed to normally serve people according to how they come. That's, they are supposed to follow the queue, because there's always a queue. They are normally supposed to follow the queue, but most at times in some hospitals they don't follow the queue. They go about attending to people that maybe they know, or maybe people they are familiar with, or maybe people that they see that maybe they can chip in something to them, like motivation and stuff like that. But I don't really know why that happens. So the experience I talk about was my first ever experience, my first ever hospital experience in Douala. Let me skip right to my most recent experience. That was in July when I fell sick. Back then my kids were on holidays and I was left alone with Hobia. So I fell sick and I went to, there is this private hospital that we have been going to. That is where I even birthed my daughter. Yeah, so the hospital has been good. At least their services has been manageable. We have been using the hospital for some time now, and recently, you guys, there were times that maybe the kids will fall sick and then we'll go to the hospital, and the way they attend to people, they are slow most of the time. Maybe the doctor is not even present and you will not even know that the doctor is not present. They'll just consult you and you go and sit there and be waiting for the doctor forever. Yeah, so in July when I fell sick, I took some medications at home. I bought some medications at the pharmacy and took at home, and I did not really respond well to the medication, so I had to go to the hospital. So on this fateful day, I myself and Hobby, we went to the hospital and You guys, just for the nurses to attend to us that day was a problem. You have to be going and reminding people to come and attend to you, and the waiting time that day was so long. Like after some time, they finally attended to us. The nurses finally attended to us, and the next step was to go and consult with the doctor. So while I was going there, I knew that the doctor was already inside. I went and sat there. I was about the third or fourth person, yeah. So I knew that when the doctor attends to those other people first, he's just going to attend to me. And I was sitting there and waiting with Hobie. We waited and waited, and I was like, I asked the other people that were already ahead of me, that, are you guys not going in? Is it that there is somebody in there? The patients were like, no, there is nobody in there, they are still waiting on the doctor. I was like, where is the doctor? And imagine that we went to the hospital at about 9 a.m. in the morning, and by 12 noon the doctor had not yet still come. We were there waiting until the doctor finally came at 1 p.m. in the afternoon. And behold, when he came at that 1 p.m., he never started attending to us who were sitting there. We sat and saw some other patients coming from nowhere. Like, these were patients that had waited for him the day before. That's the day before, till 5 p.m. and they were not able to be attended to, and they had to go home and come back the following day. So when he came that day at that 1 p.m., he had to start attending to those people of the previous day. You guys, I just saw a group of people coming down from somewhere. It's like they were sitting right outside and waiting. Yeah, so they came in and they were telling us stories that yesterday they came and sat here and sat for so long, and the doctor was not able to attend to them. By 5 p.m. they had to go home and come back today. So their books, so their hospital cards and books were already with the doctor. So the doctor had to start attending. I just looked at the queue, you guys. I looked at the number of people. I looked at the people who were already ahead of me. I was like, if this man starts consulting he came in at 1 p.m. and he started consulting at about 1:30, and behold, when one patient goes in, they stay in there for so long. Like at about 3 p.m. there was nothing to write home about. I told Hobby that we should go home. I can't sit here again. You cannot instead come to the hospital. Instead of getting medication, instead of getting medical attention, you come and sit and sit and sit, and your back, you're instead feeling more pains and all of that. Yeah. So Hobby was worried that now I'm very sick and we cannot go home back to the medication that I had been taking before and not responding to. I was like, let's go, let's go. I cannot stay here again. This is not promising. Like, if I even come here, if I consult here today, and then maybe I have to come back tomorrow, maybe I'll still come back and meet the same thing, and it's not going to be pleasing. Yeah. So we had to go home, and then it was already late for me to even say that I will be going to another hospital to consult at that past 3 p.m. getting to 4 p.m. Yeah. So I loved the hospital that day. I loved that private hospital that day, and I never went back again. So the following day now, I had to change hospital. Behold, we have been using this private hospital because we have insurance at this hospital 100%. So whenever we use this hospital, that's where I said it before, that's where I birthed my daughter. Yeah. So we have been using this hospital even when the kids are sick. That's where we usually take them. Yeah. So at this hospital is 100%. We don't get to pay anything that is covered by the insurance. The only thing that we pay there is what the insurance doesn't cover. Yeah. So behold, I left this hospital that day, and I said to myself that I'm never going to come back to this hospital again, no matter what. Yeah. The following day, I went to a different hospital. Still, we have insurance at this hospital that I went to, but the insurance there is just 80%, and we have to pay for 20%. So I went to that hospital, and the reception there was so nice. It was fast and everything. They just attended to me, and everything was fast. I did not even spend up to 1 hour at the hospital. The person at the reception attended to me well, sent me straight to the doctor. The doctor was already there, and there were no patients even. He's fast. He attends to people fast, and then they just leave. And they have different doctors. They don't have only like one doctor. Yeah. Yeah. Prescribed my medications, and I just left from there and came back to the office. Yeah, so that was fast. My experience at this recent hospital was really good, and I really appreciate their services. And I think that's where I'm going to be taking my kids whenever they fall sick. God forbid they should not be falling sick, because as a working mom, I don't even have that time. That's why you see me going to hospitals only around Bonaberry, because if I have to take my kids or myself to a hospital in town, meaning that I'm going to spend the whole day with all the traffic in Douala and all of that. That means I'll be missing work for so many days, which is not really good. So I decided to go only to hospitals around Bonaberi, where I can, let me say, rush there in the morning and then also leave from there and go to work. Yeah, it's my most recent experience at this hospital. This second private hospital in Bonaberi was really good. I love their services, and immediately the medication that they gave me, I took it and I was feeling much better. After my lab test and everything, the final medication was very fine, and I'm feeling very okay right now. So just to say that if you want to look at healthcare in Douala, you guys, it seems to be so expensive, such that you see people going through a lot at government hospitals because they are more affordable, but the services there are so poor. And then for someone again to go to a private hospital where you pay much more money and then you experience poor services again, it doesn't feel really good. Yeah, so I think if you're looking for a very affordable hospital, you can either go to a Baptist hospital. I really love Baptist hospitals, and then Presbyterian hospitals, and then the private clinics and the private hospitals come because they are much more expensive. Yeah, so if you're new in Douala and you fall sick and you want to go to the hospital, you need to know that the most affordable hospitals are the government hospitals, followed by the Baptist, followed by the Presbyterian hospitals, and the private hospitals and clinics are much more expensive. Yeah, I'm going to move forward to comparing my experience in Bamenda. Yeah, healthcare in Bamenda in general is much more affordable than in Douala. And when you get to the hospital in Bamenda, they attend to you well, they are polite. Yeah, like they receive you well, they follow the queue and send you to the lab, and they are so much affordable than hospitals in Douala. From my own experience, I enjoy healthcare in Bamenda much more than healthcare in Douala. Yeah, so if you've lived in any of these two cities, let us know which town do you enjoy healthcare more. Which town do you think healthcare is less expensive or is more expensive between Douala and Bamenda? Yeah, if you have ever lived there, and if you are living in any other city in Cameroon, please let us know how healthcare in your own city is. It affordable? Is it expensive? How can you compare government hospitals, private hospitals, Presbyterian and Baptist hospitals? I've never been to a Catholic hospital, so I cannot really say. Yeah, so that's just my experience that I wanted to share with you all. If you've watched up to this point, thank you so much. And if you haven't yet subscribed, do me well to hit the subscribe button and turn on your notification bell, so that once any new video comes in, you get a notification and you watch. Thank you, and see you guys in my next one. Bye bye.